Very busy day in the State House, as always. Hello, everybody, and welcome to our celebration of International Women's Day for 2026. My name is Senator Ilana DiMario, and I am so grateful to be co-hosting this event today with my partner in the House, Representative Kathy Fogarty. This is the 115th celebration of International Women's Day, and every year International Women's Day has a theme, and this year's theme is Give to Gain. The idea being that when we give, we gain. This theme encourages a mindset of generosity and collaboration. Give to Gain emphasizes the power of reciprocity and support, the idea being that when people, organizations, and communities give generously, opportunities and support for women increase. Giving is not a subtraction, it's actually an intentional multiplication. When women thrive, we all rise. Whether through donations, knowledge, resources, infrastructure, visibility, advocacy, education, training, mentoring, or time, contributing to women's advancement helps create a more supportive and interconnected world. The women we have here today embody this spirit, and we are so grateful they have chosen to share their time and talents with our state. I also just want to say that as a graduate from a women's college and as somebody who previously to entering politics has made my career in a female-dominated field, the concept of giving to gain is something that is so familiar to me and probably familiar to everybody in this room who has worked with women. It is, if you think back over the course of your education, over your professional career, about the people who have reached a hand out to share their time, their knowledge, their expertise, their resources with you, most likely many of those people are women. And I appreciate the theme of this year's celebration, and I also just want to use it as an opportunity to mention some of the women in this room who have embodied the spirit in our Senate chamber already. So I want to recognize Senator Linda Ujifusa and Senator Bridget Valverde, and also my colleague, Senator Pamela Loria. I will leave it to Representative Fogarty to introduce the members of her chamber, and now I will turn it over to her for introductions. Oh, Senator Ana Quesada, how could I forget Ana Quesada? Thank you so much. Of course, I'm going to hand it over to Representative Fogarty to introduce the members of our panel today. Thank you.
Thank you, everyone, for coming for International Women's Day today. Before I get started, I'm going to introduce the one man who's going to be speaking today. But it's okay, because he is an advocate for women and truly appreciated. So I will introduce the Speaker of the House, Joseph Sakachi, to have a few words. Thank you.
Thank you, Chairwoman Fogarty. I'm honored to be the only man speaking, and I'm happy. So thank you very much. And I want to recognize, obviously, Greg Amore, but also Lieutenant Governor, who's here as well. Thank you. Look, this is a wonderful event. I know most of you here, and I know Kathy's going to recognize the representatives, but I want to tell you something. I have promoted on my senior staff and in my leadership team more women than ever before in the House. And I did not do that because they were women. I did that because they're competent. My chief legal counsel is the best. My policy director is the best. My leadership team with Katie Kazarian and Mia Ackerman are the best. The women chairs that we have, Kathy Fogarty, I can go down the list, I know she'll recognize them, but Susan Donovan, Grace Diaz, I can go down the list, but are very good at what they do. And it's an opportunity to celebrate. And I look at the all-star panel you have here. They are very strong advocates for their cause. I want to tell you that I am proud of so many things that we've done in the House. The Roe v. Wade, the state version, that when we passed it, no one thought we ever needed it. And thank God we did, and we needed it. And equal access, the ECA for equal access, so everyone has the right for health care. But I'm single most proud of the biggest achievement for the women, and it took us a long time, and we were actually heading backwards until I sat down over a weekend with Kelly Nevins and Susan Donovan. It was a Father's Day weekend in June, and I had the business community, and I had the advocates for equal pay for equal women. And we separated them in 2 different rooms, and it took about 6 hours to get done. I think Working Families were there as well, Georgia, Hollister, and we worked hard to make it one of the best laws in the country. And other states are taking the Rhode Island model and implementing it around the country. And I did that because it was the right thing to do. And because it was important for Susan Donovan, it was important for me. It was important for the women of the House and the women of the legislature. It was important for everybody. Everybody should be paid equally for the work they do. There should not be any kind of a gender disparity when it comes to paying people a living wage. Because I look at a person as a person and not as a woman or a man. And I just want to say thank you for all you do. Thank you, Senator Mario. Thank you, Kathy Fogarty, for putting this wonderful event on. And please continue. I know there is other women who, which I'm going next to. The Rhode Island Energy is having a House information panel. They are on their way here. You'll have greater attendance. Thank you very much. Thank you.
Thank you, Speaker. And again, I want to point out that our Lieutenant Governor, Sabina Matos, is here, our only top executive. So again, gracing us with their presence, we appreciate that. And I also am very happy that it was mentioned before that Greg Amori, our Secretary of State, is here. And Secretary Amori has done something for women that in the executive branch, he is about 100% woman run his department. And he went in there because he has a wife and 2 daughters who point him in the right direction, and we appreciate Lee's work and your daughter's work, too, on getting you in the right direction. So, again, thank you all for coming. I want to also point out the Representative Mia Ackerman is here. I also saw Representative Edie Agello has come, and Jenny Fuentes is here. And did I miss somebody else in the? No, okay. Again, I know a lot of them at the Rhode Island Energy because the energy bills are a big problem, and so a lot of the reps wanted to go there, but they are coming after to attend. So, Senator DeMario and I would like to really thank Kelly Nevins from the Women's Fund of Rhode Island for her help and putting this together and helping me assemble this great, or helping us assemble this great group of ladies. Oh, I just see Rebecca Kislak and Representative Michelle McGaugh has just arrived too. So today we have Osorio, who is the Executive Director of the Perinatal Education Center. Weayonnoh Nelson-Davies is the Executive Director of the Economic Progress Institute. Priscilla de la Cruz is here. She is the Director of Sustainability for the City of Providence. And Maria Kasparian is the Chief of Staff for Etsia Nutrition from Quatia. And all of these women are great leaders in their fields and, have gone up against some tough political wins lately. So they're here to talk about it. Kelly will be doing the questioning for our holding the forum. So I appreciate that, Kelly. And we will see what the women have to say and how they've put up with these tough economic and political headwinds. Thank you, Kelly.
Good afternoon, everyone. For those of you who don't know me, my name is Kelly Nevins. I'm the CEO of the Women's Fund of Rhode Island, and our mission is to invest in women and girls through research, advocacy, grant-making, and strategic partnerships designed to achieve gender equity through systemic change. I want to thank Representative Fogarty and Senator DeMario for convening this important International Women's Day conversation here at the Rhode Island State House. Of course, this is also the month of National Women's History Month, and so we at the Women's Fund all week we're having different events with different groups of people, and I'm so pleased to see so many of you here. International Women's Day is both a celebration and a reckoning. A celebration of women's leadership and a reckoning with the reality that progress is neither automatic, nor evenly distributed. When we talk about a sustainable future, we're not only talking about climate, we're talking about whether families can afford housing, whether mothers can survive childbirth, whether workers can earn a living wage, whether food systems can nourish communities, and whether public policy reflects lived experiences. Sustainability is about designing systems that allow people, and particularly women and girls, to thrive across generations. So today's conversation, during the conversation, we're going to explore what if a sustainable future looks like, how we build it together, and I'd love to get started. All right. So I'm going to throw questions at everyone to start off with, and then I have some very specific questions based on the expertise of our panelists here, all of whom are advocate leaders in our community and in specialized areas. So the first question is for all of you, and it's, when we say sustainable future, what does that mean in your work? And who benefits first? And we'll start with Maria. And Maria, it would be great if you could also just briefly talk a little bit about your organization.
Sure.
Oh, is that on?
Sure.
Okay.
Testing. All right. Thank you, Kelly. We really appreciate the opportunity. I think I speak on behalf of all of the panelists. My name is Maria Kasparian, and I'm with Edisia Nutrition. We are a nonprofit based out of Quonset with the mission to end malnutrition globally. And for us, that takes several different forms. We manufacture specialized foods that look like this. They're peanut, milk, soy-based pastes that are therapeutic or supplementary in nature to either treat or prevent malnutrition at various phases. And we focus on young children and on pregnant and lactating women, because those are the populations the most at risk of malnutrition and with the most opportunity for powerful change when they have good nutrition. So when we say sustainable future, my head goes right to the first 1,000 days of life. That means from pregnancy through a child's second birthday. Those are the really key times in life to have the right nutrition for the right body and brain development. And for us, that is central to everything else. We can't have sustainable anything if bodies and brains don't have that opportunity from the get-go to grow and develop and reach the potential that they can. So that's what I think of when I hear sustainable growth.
Thank you. Weayonnoh.
Hi, everyone. My name is Weayonnoh Nelson-Davies. I'm from the Economic Progress Institute, and we're a policy, advocacy, and research organization with a mission to advance racial and economic justice. And we do that by making sure we're focused on the most marginalized amongst us, so communities of color, low and modest income Rhode Islanders, to make sure everyone have access to economic opportunity. And so when I think of sustainable future, I always go back to Heather McGhee, The Sum of Us, the book she wrote, and she asked this question about why can't we have nice things? So I think of what those nice things are all the time, and that have directed the work we do, right? What are nice things? A home, a safe home to live in, that's nice. Affordable or universal childcare, really, really nice. Universal health care, very, very nice. And I dream of these things, and education, where every child goes and get a good education. And these are not food streams. These are things we dream of, but at EPR, we go to work every day to see, can we get Rhode Island to the place where everyone have nice things? And I think when we do have nice things, then we have a sustainable future.
Thank you. Q?
Here we go. Hi, my name is Quatia Osorio. I go by Q. I'm the executive director of the Urban Perinatal Education Center located out in Pawtucket. We are the first Black and BIPOC perinatal health center that is in the community. We have our doula referrals, our childbirth education, lactation, and of course the first CHW-ran easy access clinic in the state that focuses on counseling and wellness. And so when I had wrote down my answers for this question, it was economic equity and accessibility, transformative workforce, and community safety. Community safety is very important, especially now what we see on TV all the time with people basically being kidnapped off the streets. And it was, well, who benefits first? And I want to eliminate that. It shouldn't be about first. We should stop focusing on who's first, who's last, and yet we need to focus on who all are coming. Who benefits for this? Mothers, fathers, aunties, uncles. Not everyone is going to be a mother, so you need to expand your thought process of who is going to support this new birthing person, who is going to support this new baby, the grandfather, the grandmother. Really think of communities as diverse networks and moving away from this mom and baby dyad, or mother, father, or mother, mother, or birthing partner and birthing person. Move away from these very small things and move out to expansion. A community is who raises a child, and a community is who raises a birthing mother, and a community is who also supports and sustains and raises a father and a grandfather and a grandparent, right? And our aunts and our uncles and our community leaders, right? They are all participants in us growing our communities. So really the expansion of realizing and recognizing the value that each one of us has, and our impartation into the next person and the future that is coming.
Thank you. And Priscilla.
Hi, everyone. I'm Priscilla de la Cruz, Director of Sustainability for the City of Providence. What I love about presenting next to the women that are next to me is that you're going to hear a lot of similarities in the things that we're saying. I might look at it through a different lens in terms of the workspace that I'm in when I think about climate, when I think about the environment, but we're working at the core. We're working on very similar things, right? When I think about my work in the City of Providence of implementing our climate justice plan that really looks at how do we prepare our communities to live in a changing climate? How do we ensure that they're going to have the tools that they need to thrive and succeed and access opportunity and prepare, right, for those changes, but also mitigate the things that are impacting us? So when I think about a sustainable future, I think about how do we live in an environment that does not make us sick, right? These issues are so intersecting. It's not just climate and environment. It's also health. It's also transportation. It's also housing. It's also jobs. So to be in a sustainable community, right, what builds resiliency? You need access to resources. And we think, in my work in the Department of Sustainability, we think about no one can be left behind, right? We're working on these solutions for everyone, but what we have to identify are the blind spots. Where are there pockets of our community where we know folks don't have the same access, and they haven't had the same access for a really long time, right? And I often see people think about issues of equity through the lens of equality, and we're talking about different things, right? We're talking about that today, right? I need 2 bananas to be well off. You only needed 1, right? So how do we distribute those resources equitably so we can make sure that people have a fair chance and access? And as we think about transitioning from a fossil fuel-based economy that's impacting our health, right? And if something's impacting your health, it's impacting your income, right? And if your housing is not healthy, that is impacting every aspect of your lives. So as we're transitioning to a green economy and different types of jobs, how do we ensure that everyone has a fair and equitable shot at those type of jobs, right? So in order to really measure sustainability, you have to look at, are people better off? Are they healthier? Are we living in a world that is just serving people better?
So the Women's Fund is working with the Economic Progress Institute and many other organizations on equity scorecards and asking our legislators to think about making equity statements in the broader community about the things that they are working on. What are the measures that you use to identify whether progress is being made or not in the work that you do? And I would love to start with Priscilla on this one. Yeah.
Yeah, we look at so many metrics. If I were to name a few, looking at the work that guides me every day for the City of Providence, when we think about, for example, having opportunities in the offshore wind industry, are these jobs, are they providing family-sustaining wages, right? We don't, or in the solar industry, right? What good does it do to a community that hasn't had access? When I think about the composition in Providence, primarily Black, Latinos, Indigenous population, if they're going into a war of exploitation, right? If they're not going to be able to live themselves out of poverty. And as we're creating also systems of change, how are we not displacing people? And one of the things we heard a lot, and we still hear when implementing our climate justice plan is, okay, great, Director De La Cruz, you're gonna make sure that my community has more trees, right? We're gonna be able to have more green infrastructure, things that help with flooding. You're gonna help with the heat island effect, increasing that tree canopy. You're gonna make sure we have access to clean energy, we have better homes, but then am I not gonna be able to afford living here, right? So it's like looking at the entire picture. So we have to look at metrics in that way. And also I think an area that's very intersecting for some of us up here is when we think about like health. We look at there are pockets in our community where there's a higher concentration of climate pollution, and that correlates directly with asthma rates in our community. And for me, I think it's really full circle to think about my lived experience and things I saw in my community with relatives, right, being disproportionately impacted by asthma and what that meant for their home. And then as an adult in this space, then looking at the science and the data, it's like, oh, well, look at where we live, right? We're close to the Port of Providence, right? We're close to the highways. So it's really looking at all those metrics holistically.
Thank you. Q, what kind of metrics are you using to identify whether progress is being made?
Oh, our metrics are really interesting. I do want to give a plug for the asthma. Formula feeding actually increases asthma rates. So if you can breastfeed your babies, that would be great. We need to have more inclusive lactation in our community, services, support, and education. For me, it's a change in culture. So you'll see a dynamic shift. We used to be a culture where, and we're seeing this now in healthcare, was whatever your doctor says, you believe them. They're not going to do any wrong. Now we have a population that's questioning, they're asking, they're doing research, they're taking full autonomy over their body. When we have moms that say, oh, I had a cesarean, so one cesarean birth, always a cesarean birth, and now they come back and they say, oh, I have the right to attempt a vaginal birth after my cesarean. I think I'm going to try for that option. Actually, I'm going to choose to breastfeed. I'm not going to formula feed. Oh, I think I'm going to introduce baby-led weaning with my child. So we're seeing a cultural shift of the generations before. And I can say, as one of the childbirth educators at our center, we see this dynamic when the mom comes in with her child for childbirth ed, and the mom has a certain standard of how her birth was, and her daughter, who is now pregnant, has a completely different perspective. I want this for my option. I'm going to have a doula. I'm going to have a natural birth. I'm going to do that. And the mom is like, well, why would you do all that? Like, why would you? And we're seeing there's a shift from one generation to the other. This person is owning their choices. They're saying, I'm going to do this. And then we give the education, back to the mom. I remember we had a mom who came in, and she had 4 children, and she was so proud to tell us that. I'm a mom. This is my first grandbaby, and I've had 4 kids. And we were like, oh, that's wonderful. And she sat through the birth class, and she said, I didn't know anything about what was taught today. And our classes are 2 hours long. And she's like, I had 4 children, and I had no clue. I had no clue about my rights. I had no clue what my body was going through. I just let them do whatever they want. And it is so beautiful to see that my daughter now has a different option. And now she has education and resources. And she's like, this is amazing, right? And so for us, the metric looks different. We're seeing a change where the optics of it. We're seeing a diversification within our communities where it's no longer an innovation to have a school that teaches multiple language. It becomes a standard that schools prepare our children to be global citizens of the world, and not just, oh, you might get the option for Spanish if you sign up in high school. Now we're starting as early as preschool, right? These are becoming our standards. So we're starting to see a more cohesiveness of what it looks like to be global citizens in the United States, rather than just being that American citizen who only speaks English when we go to other countries. We're actually diversifying it. We're setting that standard. And then also normalizing education, childbirth education amongst each other. I'm of the each one reach one. So whatever information I give you, you are now an advocate to educate someone else. And so creating those dynamics within our communities to really develop. And then we see the metric change. We see the change of care in the hospitals, right? Before, when we did the doula bill, no one knew really what a doula was. And now everyone's like, oh yes, I want a doula. I definitely would like to have a doula. And we're changing that. Childbirth education, lactation services, community-based providers and practitioners, home birth midwifery. We're changing the landscape to offer more. And so our metrics looks like a cultural change for us.
Thank you. Let's start with Maria and then come back to Weayonnoh.
Sure. All right, metrics and lived experience. So I'm going to go global, but everything global, the world is all connected, so it reflects the entire world. But when we're talking about global health metrics, one of the most important indicators we look at is child mortality versus child survival. Right? And there's been a huge focus, and when we say child, we're talking about children under 5. These are the most vulnerable people anywhere in the world are children under 5 who need good health care, need good nutrition to survive and thrive. So starting in the early 90s, there was a big focus on reducing child mortality. At that time, about 13 million children died every year from almost exclusively from preventable causes, right? Malnutrition is a 100% preventable cause. So that was starting in the 90s, 13 million children. Since that year, it has steadily gone down with interventions, including nutrition, but of course not exclusively, vaccination, childbirth support, malaria treatment, TB treatment. All of these things really focused to get child mortality rates down to the low point where they've been is now below 5 million deaths per year. That is still too high, but below 5 million deaths is a very big difference from 13 million deaths. Unfortunately, 2025 is the first year that the final numbers aren't out yet, but the numbers will go up for the first time since 2000. They hadn't gone up any year since 2000. And this is directly because of dramatic cuts to foreign assistance that happened in an instant, and there wasn't time to transition to other supports. There wasn't time to transition to other resources. So that's a very sobering fact, and also something that lights a fire under us currently to figure out other solutions and figure out other resources, because that's unacceptable. When we talk about lived experience of the populations, the communities that we worked with, the lived experience that we want to see, and that our programs, so I should have said earlier, we don't work alone. We work with partners all over the world, right? So we partner with the US government, we partner with UNICEF, the World Food Program, NGOs like Save the Children, Doctors Without Borders, World Vision, those type of organizations, as well as local ministries of health and clinics. The major innovation of these type of products is that they're used for community-based care. Instead of hospitalizing kids, as was done previous, because they're shelf-stable and ready to eat, they're programmed through community clinics with community health workers. So the positive lived experience looks like local clinics being stocked with the supplies they need and community health workers they need, so that moms, I say moms, but it's not always moms, it's community members, caregivers have access, so that if their child is sick, or if their child is malnourished, they have somewhere they can go to, and there is a supply. The lived experience that we unfortunately are increasingly seeing right now is clinics that are stocked out and community health workers who have been let go because there are not resources. So we're currently, us and many others, are working to flip that and figure out ways to not just get back to where we were, but continue growing that access.
So at EPI, we use our Rhode Island Center of Need to measure what sustainable future look like, or what currently people need. And we're doing a new report in 2026, so look out for that. But in 2024, that report found that 68% of single adults with all children could not meet their cost of living in Rhode Island, could not meet ends meet. 78% of single parents with 2 children in Rhode Island could not meet their cost of living. And then when you break that single adults without children, that 68%, it goes up to 73% for single women without children. And what that measure tells us is something is off. And these are working people, because most of the time people will say, oh, people are living off of safety nets. But this standard of need measurement is for people who are working and cannot meet. We're talking 78% of a parent who's working still cannot afford housing or childcare. And what that tells us, most of the time when you hear these numbers, the solution becomes, well, everyone needs to get a better paying job. And that sounds great, but the part that always gets to me is, so the person who is in that child care center taking care of my child needs a better paying job to afford rent. Why can't that be a better paying job? The person who's helping to stock groceries for us to eat needs a better paying job to be able to pay for transportation. Why can't that be a better paying job? Because our measurement is everyone should have a living wage. Every job is important to our economy, so every job should be valued that it can be better paying at that level, and everyone do need to go up or be a construction worker or do these things that are supposed to pay them better. We need a society that pays everyone better so they can afford the cost of living. And so we really measure that. And then we go beyond that and measure between groups, like parents, women, based on race. Are there gaps in the system? And one of the reasons we've been pushing, and I remember very clearly my first coffee with Kelly, we need policies, because I'm in a policy work, to address those issues. And so we need to think about equity. Why are certain workers not making a living wage versus others, right? Why are certain policy passed that impacts different communities in ways that don't help them to thrive? And that's part of the measurement of this equity scorecard we're talking about. Instead of waiting until the policy is implemented and be like, oh, oops, we made a mistake on that one. Why don't we be proactive to avoid creating policies that continue to harm communities? And so we use the Rhode Island Standard of Need, and we'll also use things like the equity scorecard to really dive into why we don't have nice things.
Weayonnoh, I'm going to ask you to build on that a little bit more. So there are a group of folks who are advocating for this equity statements on 20 bills in the General Assembly this year. Can you talk a little bit more about what a legislator might do to make an equity statement?
Yeah. So we've tried different things since we started to see what will work for legislators. Because we know you all are busy. We know you have a lot of bills to deal with. And so we decided to maybe do a pilot, right, where the Commission on Health Advocacy and Equity will do a pilot of 20 bills, just to look at 20 bills and see what are those 20 bills doing for based on race, based on gender, based on ability, based on age, and then assess, is this policy good for that community or not? And if it's not, what do we need to do about it? But the scorecard is something anyone can use, and not just legislators, all of us, as we do our work. Are we really doing what we need to do to get to the future we want? And so everyone can take, while you're sitting on the floor and there's a boring bill that you've heard 1,000 times, you could fill out that scorecard on something you want to vote for. Or you could fill it out if you're going to show up to the State House to advocate on behalf of something. It's a one sheet and be like, am I supporting something good here, or am I really standing in the way of progress? And that, as we talk about culture, we need to build culture within ourselves, because we throw out these words and we're not sure how they are implemented in practice, and this is a way for us to practice what we preach and really do what we must do to get to where we need to in the State House and beyond.
What's the bill number?
Oh, I don't know.
Sorry.
I know we have the House bill number. Yeah. We don't have the Senate bill number.
It's all good. Priscilla, cities are where climate change becomes real. You deal with flooding and heat islands and infrastructure strain. How can we ensure that climate solutions don't leave vulnerable neighborhoods behind?
I point to the model that I know in the city of Providence, but also that guided my work even before I got to the city of Providence, is you have to center the people that are impacted, right, in that policy making, in the decision making. So in Providence, when I'm looking at a policy tied to improving equity outcomes in communities that are impacted, disproportionately impacted by flooding or heat island effect, I am talking to those community members, right, about that policy. And I think the same applies here, right? If we're talking about legislation that is going to impact workers in this transition from a fossil fuel-based economy into a green economy, then we're talking to those workers, right? So it's really centering those voices, and I think that helps us to ensure that we're not leaving people behind. Often in the city of Providence, I would hear even before formally doing this work as a member of the community, it's like, well, you know, if you are elevating the voices of certain communities, then what about the rest of us? And it's like, well, we're all going to be better off, right? Because we're creating policies, programs, solutions that are really tailored around the folks that are usually not at the table, that are usually left out of those rooms, right? And we're all going to benefit from that. One other, thing that I really think about is when, again, we're talking about like energy affordability. And here's where I think about, it's such a time of the moment discussion now, but I think about growing up, as a young girl. I was sitting with my mom talking about those bills and trying to explain to her why I thought the bill was increasing as a young woman, right? And here we are many years later. I'm not going to tell you how old I am, but many, many, many years later, where we're having the conversation about like, oh, well, is it our clean energy and energy efficiency program? So like, no, I was having that conversation with my mother about escalating energy costs and us not being able to afford, right, putting food on the table because we were afraid that our electricity was going to get shut off or that we were not going to have enough gas, right, to be able to heat up our food or to make food, right? So I think we really have to look at that and talk to families that are being impacted now. And that's why I love hearing about EPIs like equity scoreboard, and then also what I'm talking about in terms of talking to those most affected, because I think that will help us really drive what are the solutions we should be putting at the table and asking questions about why. Let's get to the core of this issue, right? What has been part of that energy, that energy bill for a long time, right? The energy has to get to your home, its transmission, the type of energy coming to your home, mainly fossil fuels, right? So being part of a volatile market. So I think that will help us craft better solutions when we understand how it's impacting people.
Yeah, and so we know many of the legislators in the building right now are coming from or still attending a hearing with Rhode Island Energy, just to those points. So thank you to everyone in the building. Q, what policy shift would most dramatically change birth outcomes for the better in Rhode Island, particularly for the populations you serve?
I have a lot of policy ideas.
How about the top three?
They're all great.
Yeah.
We passed a doula bill a couple of years ago. I currently have a licensure for lactation insurance coverage. This is lactation counselors. Currently, this is our second year coming to the House with that one. And then, of course, our community licensed practitioners. That is our certified professional midwives for insurance coverage. Because we need to diversify where we give birth. Not everyone is a high-risk birth that needs high-level, high-risk treatment in the hospital, right? And if you think of the cost of hospital from entry, from triage to staying in for the 2-day stay, that bill is at minimum $45,000, and you probably didn't even get medication yet, right? And so comparing that to someone who's going to have a normal physiological birth, low risk, this is a cephalic vertex presentation, just means your baby's head down, and you're just going to have a easy breezy birth, right? But we don't have access for that option in a way that's equitable to everyone. This is where we get into the disparity of the haves and the have-not. So people who have these beautiful, lovely home births that you see all over the internet with the water births and the beautiful lights and the happy family and the kids playing in the pool, those people have disposable income of over $10,000 to be able to afford that on-call care, to be able to afford that intentional 1-hour session prenatal visit with their provider, that when they have their baby within 24 hours, guess who's going to be back at the door? Their midwife, providing that clinical care, versus your 48-hour stay, and this is not a shout out to the hospitals because I have had hospital births, where you're sent home to climb up 3 or 4 flights of stairs to get to your room and then hope that, your partner or someone in the community is going to come and check on you while you're either recovering from a cesarean birth or just recovering from a vaginal birth, and it can be very isolating, and it can be very dangerous, and it can be very risky. So we talk about maternal mortality and morbidity. We talk about infant mortality and morbidity, but we don't talk about the exhaustion. We talk about the environmental toxins. One of the things that I do is when we score the card, I always ask, which part of the house do you live in? There is a risk to being in an illegal basement apartment, but there's an affordability to being in an illegal basement apartment. There is a risk to being in a fourth floor or third floor attic apartment, but there's an affordability to living in that fourth floor apartment, right? And so it's not always so black and white, and these metrics aren't always inside of clinical care. So the policies that we need to pass is a more robust, a more diverse, community-based providers and practitioner landscape. People will say, oh, cute, when's that birth center coming? When I have the providers that could work in the birth center, because there's a particular workforce that works in the birth center. There's a particular modality of care that works in the birth center. It is not reflective of the hospital. So you have to build the workforce, but you have to provide the education, you have to provide the access, and you have to create the policy to sustain the infrastructure for that to work. That, of course, is all cost savings, by the way. And so I just want to say, those would be some of the policies. And yes, they will predominantly support a lot of Black and BIPOC communities who want to have easier access, because these are people who are giving birth in their homes, accessible transportation, people are coming to meet them where they are. And also, it creates a demand so that we can build freestanding birth centers in the state of Rhode Island, so that we can diversify when we see hospitals like Newport that are under attack, and we're wondering, are we going to be able to maintain our maternal health landscape here, and how are we going to diversify and sustain our ecosystem?
Thank you. And Maria, how do global crises connect back to local community resilience, like here in Rhode Island?
Great question. While we do focus, is it on? No. Hello?
Yes.
As I said earlier, you can't really separate global, we are a global world. We can't really separate local from global anymore in a major way. So our workforce, we have about 150 staff. We're from many states of the U.S., and we're from 26 different countries. We actively, since day one, have recruited from the refugee population in Rhode Island to bring our work full circle, because much of the products and services we provide are to refugee camps and places where people are displaced for various reasons, often political, often conflict related. So those populations, so that's people from, we have a lot of folks from DR Congo, we have a lot of folks from Burundi, we have people from Laos and Cambodia and Sierra Leone and Haiti. And when global resources suddenly shrink back, and that is related to U.S. government and U.S. aid being dismantled this year, but not U.S. alone. Germany has decreased resources, the UK has decreased resources. There is a global trend of decreasing resources flowing from rich countries to poorer countries. And when that happens, that puts even a heavier burden on people who have family members back in their country of origin, on remittances, on them to do even more, to send back more, to support. Because when there is no transition time, especially, the immediate transition is from the families, from communities. So when the global resources are reduced, it puts a higher burden on our families in Rhode Island who have connections all over the world. And that is the reality. The other way, when we talk about resilience, though, I want to also there's also opportunities for new partnerships and new ways of working. So I think we also realized that our little voice, I shouldn't say little, our voice from Rhode Island was powerful, that we had influence. Our CEO and founder, Nevins, started talking to lots of media. She had about 100 interviews during 2025, and this was like New York Times, Boston Globe level, and many others were afraid to speak. And in her speaking, we actually were able to bring more attention and bring more pressure upon mostly the federal government to make some changes and to hold themselves accountable. They said they were not cutting life-saving aid, but they were. So we held them accountable to reinstate some of the life-saving aid that they had cut. So we realized we could do that. We realized we also couldn't just rely on the federal government, that we need to diversify more and find new philanthropic partners, new NGO partners, new ways of working. And so from, even from Rhode Island, we were able to do that across partners in many different states and then also globally.
Thank you. So we are getting close to the end, and I know that doing advocacy work, thinking about the communities that we serve and doing all the things that we do can be really taxing. And that includes for our legislators in the room who care deeply for their communities. What is one thing that each of you does to help recharge, to give you enough energy to go out the next day and do what you do? And we'll start with you, Priscilla.
For me, for a really long time, it's been the community built right within this work. You build your relationships with your colleagues, and you lean on one another. And that has gotten me through some really taxing times where I felt burnt out, and having that commonality, right, where we all needed each other at some point to lift one another up.
Yes, and so I am one of the very few urban farmers who's kind of anti-urban farming, and that's my therapy. So I'm coming into the peak of my season where I get to spend a lot of time in soil and seed, and it reminds me of the humility. I cannot make that seed grow. All I can do is create phenomenal conditions in the hope that that seed will grow. And then in nourishing that seed, it will then bear fruit for me. And so it is an act of reciprocity that constantly reminds me it is my therapy to myself, but it is my therapy to my community when I grow food, because then oftentimes with that food, I also give that food away. And so that would be my act of self-care.
Give to get, part of the theme. Weayonnoh?
I take naps. Even my kids know. They will open the door, oh, mommy's taking a nap. And I need it. I need rest because my brain doesn't shut down. So I take naps. I dance a lot. That brings me joy. I'm never sad when I'm dancing. And so that's how I find joy outside of what is heavy work at times.
Thank you.
I agree with yes, yes, and yes. And in addition, I would say I have a little baby girl at home. She just turned 1 on Sunday, and she was born in March of last year, so in the midst of a very chaotic time. And she gives me hope, and she also puts a face on. I always say, like, okay, you're representing the babies of the world here. And she just recenters me and gives me hope, and she's got really good cheeks, and just kissing those cheeks is very therapeutic and reminds me why I'm doing what I'm doing. Thank you.
I want to thank you all again for your time spent with us. Happy International Women's Day and National Women's History Month. Keep doing what you're doing. Please support these important organizations and these women in the work that they do. Have a great day.